Okay, so I'm going to walk you through the placing of a sealant. So once bite wings are taken and the dentist expresses need for sealants, that's when we can begin the procedure. First, we will explain the procedure to the patient and provide UV protection from the curing light and the chemicals. And we will also make sure everything is prepared and assembled. So the first step is to dip the prophy brush in the pumice, and then you're going to clean the debris out of the tooth's grooves, pits, and fissures. All right, and then we're going to rinse the pumice off with the air water syringe, and then we'll use the suction as well to suction out all the water. Okay, and then we're going to isolate the tooth by placing the dry angle against the buccal mucosa, and it's going to be placed over the parotid gland to keep saliva out of the area. And then we'll put the cotton rolls on either side of the tooth. And then we're going to follow with suctioning any extra saliva out. And then we will thoroughly dry the tooth surface with air for 20 seconds. Okay, and then we will apply etchant in all pits and fissures, and then we'll wait the application time, which is typically about 15 to 60 seconds. You want to make sure you get in all the pits and fissures and grooves. Okay, we'll say that was 60 seconds. Then we will rinse the etchant off with water and suctioning and use air to dry. And then we'll check to see if there is a chalky appearance with using a mirror. And if it is present, it's good to keep going, but if not, we'll have to repeat the acid etchant. And then we'll also want to keep the tooth dry using air. And then now we'll be able to place the sealant. So placing the sealant. And then we can also adjust the flow into the pits and fissures with a micro brush, which helps spread the sealant out. And that way we can check also for overfilling areas. And then we will cure the sealant for manufacturer's time, which is usually about 20 to 30 seconds, but it can vary. We'll cure the area. And then we'll use a cotton tip applicator to remove inhibited layer off the top of the surface. And then after that, we will check to see if there are any voids or retention with using an explorer. And you'll really try to pull it off to make sure that it's sealed in there well. And then we'll use water to soak the cotton roll and the dry angle to help with removing from the mouth because it'll be more comfortable. And then we'll use floss in the interproximals to check that the tooth next to it is not sealed together. Floss. And then we'll dry the tooth again. will have the patient grind, clench, and bite down on the articulating paper to check for occlusion. And if there's blue pieces that are in the fissures and the grooves, that is not good. So then after that, we will apply fluoride to be sealed to the sealed surfaces. And then lastly, we just would want to state in AdPi that we etched and sealed number 18 using light curing sealant product. And that should be all.